Some ways for a client to find a culturally competent therapist can be first through word of mouth, talking to friends, family, and people in your community that may have experience with therapists that they do feel comfortable with, that they recognize might have some cultural humility. Another way can be interviewing the prospective therapist. The therapist works for you. So feel free to ask questions, ask the therapist if they have been trained in any cultural competent based trainings, and if they've worked with other clients from communities that you are from. As you begin to work with a therapist, it's understandable that it takes time to feel comfortable and safe. Earlier on in the therapeutic relationship, if you have concerns, questions, it is the space to ask the therapist. If you notice that your therapist says some things that feel insensitive or feel harmful, if you feel safe enough, it is okay to address that with the therapist. If you feel like the therapist does not hear you or does not address the issues, it is the client's freedom to end that therapeutic relationship and possibly explore other better therapeutic fits. When a client is looking for a culturally competent therapist, take a look at the therapist's bio. Does the therapist list any trainings that they have taken that include cultural humility or cultural sensitivity? The client can also ask the intake coordinator at any particular practice and explicitly state that they are looking for a culturally competent therapist, and even be specific. For example, I'm looking for someone who is LGBTQ plus affirming and allied, or I'm looking for someone who is from a particular religion and incorporates that in their therapeutic relationship.